Welcome to the Franklin Pierce University Master of Physician Assistant Studies presentation. My name is Priscilla Marsicovetere, and I am the director of the program. I've been here since the end of 2017. For anyone interested in becoming a physician assistant, which we also commonly refer to as a PA, there are a few requirements that must be met initially. A PA must graduate from an accredited PA program within the United States and will practice medicine with the supervision or collaboration of a physician. PAs are involved in a host of different activities within medicine, anywhere from conducting physical exams, to diagnosing and treating illnesses, to counseling on preventive health care, to assisting in surgery. The list of activities really is limited only by the scope of practice of the collaborating or supervising physician and the PA's level of skill. PAs practice in just about any clinical setting in medicine. That ranges from urgent care to surgery, whether that's inpatient or outpatient, to specialties such as dermatology, pediatrics, and emergency medicine. Essentially, there is no limitation on the ability of a PA to practice in any number of clinical settings in medicine. For people interested in practicing medicine, they often wonder about the difference between going to PA school versus medical school. While the ultimate decision in that regard is a personal one, the benefits of PA school is that it requires less time, approximately 27 months versus the 7+ years for medical school. After PA school, residency is not required, but it is an option for anyone interested in specializing right out of PA school. Another wonderful aspect of being a PA is the mobility across medical disciplines. As an MD, the provider would have to become certified in each specialty in which they practiced. This could take years. As a PA, however, there is the ability to move from one discipline to another without requiring additional specialty certification. As you can imagine, there is a learning curve when that occurs, however, and so investing the time and energy to become skilled at a new practice is the norm for a PA changing clinical specialties. Here are some vital statistics important to the PA profession. 1967 was the first year PAs graduated in the United States from Duke University in North Carolina. Today, PA programs exist in nearly every state in the country. Today, 50 states have authorized PA prescribing privileges. As of December 2018, there were more than 131,000 PAs practicing in the United States. And lastly, the mean annual income for a full-time clinical practice PA in the state of New Hampshire is about $110,000 a year. As you can imagine, New Hampshire is a rural state, so this number would likely increase in places that were larger metropolitan or urban areas. The PA profession is a phenomenal profession in terms not only of the breadth of practice PAs can engage in, but also in the projected growth of the profession. The Bureau of Labor Statistics predicts PAs will be the second fastest growing health profession in the next decade, with a projected growth of about 31%. That is just amazing. Compare that to, say, a nurse or a lawyer, which is only about 8%. Here at Franklin Pierce University, we have a very specific mission when it comes to our PA program. Our mission is to prepare PAs who demonstrate clinical excellence, embrace diversity, equity, and inclusion, who advocate for their patients, who lead and advance the PA profession, and who serve their communities. As you can see from this mission, our goal is to create a well-rounded PA who is an excellent practitioner, but one who can also move the profession forward. So how do we know if we are accomplishing that very lofty mission? Here at Franklin Pierce, we measure that by looking at a few program goals. Our first goal is to prepare students to function as competent healthcare providers in primary care settings. Now, you may have come across other PA programs in other parts of the country that have a very different mission and goal from Franklin Pierce. For example, there are some programs that are geared towards creating surgical PAs. At Franklin Pierce, we are geared towards creating primary care PAs. So how are we doing in meeting that goal? To answer that, I look at our national board exam pass rate. For the last 3 years, we have had a 100% board exam pass rate. We also look at the number of graduates practicing in primary care, and that is just over half of our graduates. Our next program goal in striving to meet our mission is to nurture student progress to optimize professional growth and retention. Now, how do we assess that? We look at the graduation rate. Our graduation rate is about 92%. Each year, we admit a cohort of 24 students, so a graduation rate of 92% means that 1 or 2 of those students did not complete the program. Now, that could be because of academic reasons, but it could also be because of personal reasons affecting the student. Our third goal is to recruit students from rural and underserved communities, particularly those from New Hampshire and Vermont. For anyone who's familiar with the location of the Franklin Pierce University PA program, we are located directly on the border of New Hampshire and Vermont. Given the shortage of healthcare providers in those areas for the rural and medically underserved communities, we have made it a goal of our program to recruit students from those areas, train them well, then hopefully return them to those areas to provide much-needed healthcare upon graduation from the program. So how are we doing with recruiting students from the rural and medically underserved communities? Recruitment rate from rural and medically underserved areas is just over half of our entering cohort. That number is about the same for the percentage of students who come from New Hampshire and Vermont. Our fourth program goal is to train students in rural and medically underserved communities with a focus on New Hampshire and Vermont. As I said earlier, we are located right on the border of New Hampshire and Vermont. There are a large number of rural and medically underserved areas near our program, as well as located at distant sites throughout the country. Whether in New Hampshire, Vermont, or a distant state, 100% of our students receive clinical training in a rural and/or medically underserved area. At least 98% of our students receive clinical training in New Hampshire and Vermont. Our last program goal is to graduate students to practice in rural and medically underserved communities with an emphasis on New Hampshire and Vermont. How are we doing with that goal? Nearly 70% of our graduates practice in rural and/or medically underserved areas. Nearly half of our graduates end up practicing in New Hampshire or Vermont. We're quite pleased with those numbers, as the need to provide excellent healthcare practitioners in medically underserved areas is of paramount importance to us. Now, of course, that is not to say that we don't also have students who go on to practice in surgical and clinical specialties, and many of those students do so outside the states of New Hampshire and Vermont. We are equally pleased with those students and their professional endeavors as well. Okay, so now I just want to give you a brief overview of the academics of the Franklin Pierce University PA program. At present, there are 3 phases to our program. Those are the didactic year, which is the first 12 months, the clinical year, which is the second 12 months, and a professional phase, which is the final 2 to 3 months of the program. During the didactic phase, students spend time mostly in the classroom, in lecture and small group format for the most part, learning how to practice medicine from PAs, MDs, NPs, and other clinicians. There's also a fair amount of skills training or hands-on training that occurs during the didactic year. Now, by that, I mean things such as learning how to do a complete physical exam, or take a complete history, or to suture, or to draw blood, just to name a few. During the second year of the program, that's where students are no longer here on campus, but are spread out at clinical settings across New Hampshire, Vermont, and other states. That is when students actually get the opportunity to put into practice all the education and skills they learned during the first year of the program. During the last phase of the program, which we call the professional phase, students return to campus after having completed their clinical rotations. During this time, they complete their final academic preparations before graduating from the program. This includes a summative evaluation, which assesses specific skills and competencies. They also do a board review to prepare them for their national board exam. At the end of that year, students participate in the program completion ceremony, which marks a transition from student to graduate. Most of our students go on to take their national board exams within a couple weeks after graduation. So what does the average cohort look like at the Franklin Pierce University PA program? Here's a bit of information on the demographics. The majority of students are female, greater than 60%. Most, but not all, of our students are in their 20s and 30s. The majority of our students come from New Hampshire, Vermont, and Massachusetts. We also see students from various other states across the country, however, including New Jersey, California, Utah, and New York, just to name a few. The overall GPA of a student accepted into the Franklin Pierce University PA program is about 3.43, or slightly higher depending on the year. That holds true for the science GPA of an accepted student as well. Okay, so here is the team at the Franklin Pierce University PA program. As I said, my name is Priscilla Marsicovetere, the director of the program. I'm joined by a wonderful cast, including the medical director and faculty, many of whom are still practicing clinically. We also have a delightful staff to help with the administrative needs of the program, including an admissions coordinator, a program coordinator, and an administrative assistant. Here at Franklin Pierce, we strive to give students a well-rounded education delivered by many different kinds of clinicians. We have affiliations at Geisel Medical School at Dartmouth, where students occasionally go to attend gross anatomy cadaver lab. We also have guest lecturers from Geisel. In addition, our students participate in interprofessional education with medical students from Geisel, as well as nursing students from Colby Sawyer Nursing Program and physical therapy students from Franklin Pierce University. We also have lecturers join us from Dartmouth Hitchcock Medical Center, which is located less than 10 minutes from the PA program. Our students also have use of the medical center's biomedical library. At the Franklin Pierce University PA program, we have adopted an innovative education approach for our students. While there are several lecture-based courses, there are also many small group, case-based learning activities as well. We utilize standardized patients who are actors from the outside community who help educate our students by playing the role of actual patients as students learn how to do history and physical examinations. We also build hands-on practice into the education. Now that starts early in the student's education, whether in the form of palpating an abdomen, listening to a heartbeat for abnormal sounds, or examining the feet of a diabetic. As students progress, they later learn clinical skills such as bedside ultrasound, phlebotomy, and suture techniques. So here is a sample of the first year courses during term 1 of the program. This is a pretty broad-based education, ranging from the ability to engage in clinical reasoning to figure out patient illness, to pharmacology to start understanding how drugs work in the human body against certain diseases, to patient care and learning how to do a physical exam. We also include clinical medicine courses to allow students to learn about a variety of different disease processes, how they present, how they are assessed, how we diagnose and treat them. This is a very busy time for students, given the breadth and depth of information they are learning. It's also a very exciting time, however, to be learning how to recognize and treat conditions within the human body. Here is a bit of information about the clinical year of our program. During the clinical year, each student completes 9 clinical rotations. Each rotation is 5 weeks long. Here are the 9 areas in which our students rotate: internal medicine, women's health, pediatrics, emergency medicine, surgery, psychiatry, and a primary care elective, which can be either internal medicine or family medicine or urgent care. The last rotation is the general elective. The difference between this elective and the other 8 rotations is that the program arranges the site at which the students will complete the first 8 rotations. Each student, however, has full say over where they choose to do their general elective rotation. Many students will use the elective rotation to explore a medical discipline they might be interested in working in after graduation. Franklin Pierce University has clinical affiliations throughout New England and a few other states across the United States. One other thing about our clinical year, the seminar weeks. At present, these are 1-week-long courses where students return to campus after completing every 2 clinical rotations. During the seminar weeks, students are assessed on skills learned during the clinical rotations, as well as given refresher lectures and skills sessions on body systems covered during the first year of the program. A word here on out-of-state clinical rotations for our program. We focus efforts on identifying and maintaining clinical rotations within a 2-hour radius of our campus. We do have clinical rotations in a few other states across the country, but the vast majority of our clinical sites are here in New Hampshire and Vermont. Students are responsible for all costs associated with housing and transportation, including those associated with clinical rotations. This is true during the didactic phase of the program, just as it is during the clinical and professional phases of the program. Speaking of the professional phase of the program, this is typically December or January through February, which is the final 2 to 3 months of our program. It includes completion of the final clinical rotation as well as the summative evaluation and preparation for clinical practice course, and lastly, board exam preparation. So that tells you a little bit about life once you're in the program. In order to be considered for admission to the program, there are some prerequisite courses which can be found on the program's website. Anatomy and physiology, biology, chemistry, microbiology, and statistics are required. Organic chemistry or biochemistry is also required. So, what are we looking for in students seeking admission to the Franklin Pierce University PA program? An overall and science GPA of greater than 3.0 is typically required, but as I said earlier, the average GPA, whether overall or science, of students accepted into the program tends to be at least 3.4. We also look for students who have healthcare experience, including time spent shadowing a PA, any volunteer time for healthcare-related organizations, students with previous health-related employment or credentials such as a nursing assistant or emergency room tech, just to name a couple examples. We also look for students with a diversity of life experiences. Now, this can come in many forms, including community service experiences, travel or mission-related experiences, and working with underserved populations. Additional attributes we look for, and which are perhaps the most important of all the attributes, are strong interpersonal skills and maturity. We seek to select a cohort that will encourage each other to achieve their strengths, that will help each other when weaknesses are identified, and that will approach the program as a collaborative effort in which they are all trying to succeed and to help each other succeed. For students in high school who are interested in the PA profession, we are pleased to announce the Franklin Pierce University Undergrad to MPAS pathway. This program allows for a direct admission of 2 high school seniors to the PA program after completion of their undergraduate studies at Franklin Pierce University. There are specific requirements for this pathway, including that the student must meet undergraduate admission requirements for acceptance into the health sciences program, as well as meet PA admission requirements at the end of their junior year of undergraduate studies. Additional requirements for direct admission to the PA program include a minimum of 3.5 cumulative GPA, as well as 3.5 science GPA, at least 20 hours of shadowing a PA in a clinical setting, and healthcare experience with populations from underserved rural areas. That experience can be paid or volunteer. Okay, so that tells you a bit about the Franklin Pierce University PA program. We look forward to taking our students from here to here. It's an amazing journey, and we are thrilled that you are considering our Franklin Pierce University home as part of your journey. This truly is a wonderful time to be a PA in America. Best of luck in your studies and in other academic and professional endeavors. Thank you.